to opt in or opt out of medical marijuana programs, just like the current bill does. So it would be stripping quite a bit of the bill and changing it over to what the voters voted on in 2000 and to put it back to that level. Recently, in March, Director Kurlikowski, he's the Obama drug czar, he spoke in California at a conference, and this is what he said about medical marijuana. He said, "The scope of our country's drug problem is disturbingly clear. Drug overdoses outnumber gunshot deaths in America and are fast approaching motor vehicle crashes as the leading cause of accidental death." Now, that wasn't just marijuana, that was the drug problem overall. It's hard to believe that since we hear so much more about H1N1, Toyota recalls, and texting while driving than we do about the drug problem that we have. The director continued on. He said, you all know the impacts of marijuana in this state. He was speaking in California, which is the model that we're following with this bill. He said, from the proliferation of marijuana being grown on public lands and indoor grows to the negative effects of marijuana use among youth, the increasing influence of violent gangs on the marijuana trade, and the problems associated with marijuana dispensaries. Barack Obama's drug czar just spoke within the last 2 months about the problems associated with dispensaries. And that's what this bill is doing right now, and this amendment would put us back to the caregiver level. So it would go back to the will of the people, what the voters of this state voted upon, what is in our Constitution, and go along that line of thinking. He continued on, said, as I've said from day one when I was sworn in, marijuana legalization for any purpose is a non-starter in the Obama administration. Says we've seen problems of medical marijuana here in this state, but also in places like Colorado, where kids are given the message that since marijuana is a medicine, it must be safe. That's what we're doing with this bill and with the other bill that we passed. We're saying marijuana is safe, and so we're going to increase the usage by kids. He continued on and said, I recently met with officials from the Netherlands. They are closing down marijuana outlets, or coffee shops as they call them, because of the nuisance and crime risks associated with them. What used to be thousands of shops have now been reduced to a few hundred, and some cities are shutting them down completely. So they've been where we're going with this bill, and they're turning backwards and saying, no, we don't want to go there anymore because of what it's doing to our children. He continued on about the issue of outright legalization, which that's not what this bill does, and that's not what's allowed under our Constitution. But obviously, with the realm of where we are today with dispensaries, that is almost where we have today with the number of cards that are out there and the number of applications that are out there. He continued on, he said, the concern with marijuana is not born out of any culture war mentality, but out of what science tells us about the drug's effects. He said, and the science is still evolving, though still evolving is clear. Marijuana use is harmful. This is the drug czar for President Obama. Said this 2 months ago. It is associated with dependence, respiratory and mental illness, poor motor performance, and cognitive impairment, among other negative effects. We know that over 100,000 people who showed up voluntarily at treatment facilities in 2007 reported marijuana as their primary substance of abuse. Additionally, in 2008, marijuana is involved in 375,000 emergency room visits nationwide. Studies have shown marijuana dependence is real and causes harm. We know that more than 30% of past-year marijuana users age 18 and older are classified as dependent on the drug, and that the lifetime prevalence of marijuana dependence in the U.S. population is higher than that for any other illicit drug. That's the director of the president's basically drug czar, Director Kurlikowski. I'm sorry, I'm mispronouncing his name a little bit. So that's what the president's office says about marijuana use and where we're going. Our Attorney General in the state of Colorado says, I join many law enforcement, healthcare, and drug treatment. I join many in law enforcement, healthcare, and drug treatment in vehemently opposing any legislation that embraces the clinic or dispensary model for distribution of medical marijuana. He said, over the last year, with the change in federal policy and the failure of the State Board of Health to implement a limit on the number of patients a caregiver can have, the medical marijuana industry has exploded. Dispensaries are claiming to be the primary caregiver for hundreds, and in some cases, thousands of patients. At the rate of current applications, we soon will have 100,000 or more medical marijuana patients claiming to have a debilitating medical condition. Liberalization of marijuana laws in Alaska, Holland, and other places have led to significant increases in teen use. The research also shows that increased adolescent use of marijuana has a high correlation with more serious drug addiction, high school dropout rates, crime, including violent crime. Let's go back to what the intent of the voters was and what Amendment 20 actually did. Amendment 20 expressly provides for a system based on patient or primary caregivers. And they have the authority to have 2 ounces of marijuana or 6 plants. The amendment uses the term patient 87 times, primary caregiver 22 times, and the term physician 28 times. It never refers to marijuana dispensaries or grows. The amendment does not have dispensaries in it. We are doing something here today that I think is unconstitutional with this bill, and you've heard that on other amendments, and that we need to go in a different direction, and that's what this amendment does. This amendment defines what a caregiver is. Let me tell you what that definition is. A primary caregiver means a natural person other than the patient and the patient's physician who is 18 years of age or older and has significant responsibility for managing the well-being of the patient who has a debilitating medical condition. A primary caregiver shall assist the patient with handling the effects and consequences of the debilitating medical condition, including administration of prescription medication, attendance at medical appointments, assuring the patient complies with dietary requirements, and assistance with other daily aspects of the patient's housing, safety, and comfort. A primary caregiver shall not include a person whose responsibilities for the patient include only the cultivation of marijuana on behalf of the patient or the provision, sale, or distribution of marijuana to the patient. That is what the will of the people, what they voted on in 2000. That's what the Blue Book even talked about. And yet today we're going off on a different path, and we have an opportunity to change that path with this amendment. Obviously, our state constitution is the controlling state law, and the legislature can enact enabling statutes as long as they are not in conflict with the Constitution. I believe that this bill is in conflict with our Constitution because of what it's doing with dispensaries, and this amendment will take us back to the caregiver level, which is what was talked about in Amendment 20 and within our Blue Book. And so I ask for an aye vote on Amendment 166.
Senator Romer.